Hi, this is Marcy White at Copley Acupuncture, and I wanted to talk briefly today about helping to turn a breech baby. I treat a lot of fertility and pregnancy in my practice, and this is something that oftentimes comes up too late, where I have a patient that I saw early on in the pregnancy or to help with fertility, and then they told me later they had to have a C-section because their baby was breech. And a lot of women don't realize that there is this great option. So if you go to your OBGYN or to your midwife, they do have an option called a manual version where they will, on the outside of your belly, try to turn the baby at a certain point and see if they can get the baby into the head down position. There are a lot of different presentations of a breech baby. The ones I see most commonly are transverse, where the baby's a little bit sideways, and sometimes the baby is in a, the complete head up position, the frank breech. And so what we can do is we can have you come into the office. I give you everything that you need, and this is something that's done at home. So you can do it yourself, though I don't recommend that, because we need you to be in the most comfortable position possible at home. And so ideally you'd want to be sitting up or laying back. And you want to be doing this at the end of the day when you're going to be relaxed and you're not going to be getting back up and going to work all day and doing a lot of things upright. So end of the day in a relaxed position is ideal. And so if you're trying to do this yourself, you'll have to bend over because the treatment is on your foot and you're going to be compressing your belly, and we don't want that to happen. So what we're using is an acupuncture point on your small toe, or what we call the baby toe. And we're not using acupuncture needles. It is a substance called Moxa. Moxa is a plant called Artemisia vulgaris that the Chinese have used for centuries, and they used it long before acupuncture needles were invented. And Moxa has these really wonderful properties. It's very warming, it's very soothing. It helps with trauma, with bruising, with injuries. But basically what you can do is you can warm this acupuncture point with the Moxa, and it will stimulate the uterus and allow the uterus to relax so that the baby can turn. So this is why it's important to be remaining in a very relaxed position and doing it at the end of your day. So I'll just show you an example of Moxa. It's a plant. They take the leaves and stems of the plant and they spin it basically into, or dry it rather, and then compress it into this substance that we call Moxa. It looks a little bit like wool, so some people call it Moxa wool. It's very squishy and spongy, and you can shape it and form it in a lot of different ways. So one method is to turn it into what's called a cone Moxa, where you can shape it like this, and you place it right on the area of the body that you want to treat, and then it is lit on fire. Sounds a little dramatic. And as it burns, the heat that is emitted from the base of this can penetrate deep into the tissue. You can also roll Moxa into a ball and put it on top of a needle, and that's called warming needle. And that heat travels down the needle and it creates a tent of heat all over the area. So this is really great for arthritis and what we call rheumatic conditions, things that are worse in cold and damp weather. For our purposes, we use something called pole Moxa, which looks like this. So it's kind of shaped like a cigar, and you light it like a cigar as well. So the best way to light this is to use a candle. It takes a little while to light this. It's mixed with some other substances that help it to not create a lot of smoke, because you're going to be using this at home. You don't want to create a massive amount of smoke in your living space. So it takes a little finesse and a lot of patience and time to get this lit. So what you do is you just gently keep turning this gradually, little by little, and you want to get the tip lit so that you have a nice even burn. So every so often, what you can do is you can blow on it. You'll see it's turning red and you're getting that nice burn. So it's, kind of similar to lighting a cigar without the bad cigar smoke smell and taste in your mouth, unless you like cigars. So once you get this lit, then you're going to be able to use it. So the method is that you use this every day for 20 minutes on each toe. And you're going to do that for about a week. So some women can get a sense when the baby has flipped, but you just continue doing this until you get a definite confirmation from your doctor or your midwife that the baby has turned. So now we're getting a nice even burn on this. So what you do is you're going to be using it, then we'll pretend that this is your pinky toe. You're going to be using it on the outside of the toe, and you get it close enough that it feels warm. And then you wait until it's kind of uncomfortably hot, and then you pull away. And then you go back until you're getting this kind of uncomfortable heat, and then you can pull away. And you keep doing this, and you do this for 20 minutes. So this is called a sparrow pecking technique, if you think about a bird kind of pecking at you. So close. And you just have to keep checking in with the person that's doing this to you. They're actually the ones that need the most patience and time, because they're going to be doing all the hard work, and you're going to be laying there enjoying it. And it actually feels quite soothing. This is called a Moxa Extinguisher. So when you're done with this, you just place it in there and it will go out on its own. So that is one method. You can also get a mason jar and fill it with rice, and you can use that to extinguish the Moxa. One hot tip, no pun intended, with using Moxa is that when you are using it, it's going to build up some ash. So you want to get that ash off. What you don't want to do is slam it like this. Now you see when I do that sparks fly, and some of the red tip of this comes off. This could fully break off, and it could land on your carpet, land on your clothes, or land on you. So you just gently use it like this if you're using a Moxa extinguisher, or if you're using a mason jar, you can use the tip of the mason jar. But it's very easy. So if you or someone you know is pregnant and has a breech presentation, you can come in, get all the supplies you need, you get instruction how to use it, and then you do it at home. And it's a really, really great method. It has a very high success rate. In most clinical trials and studies that have been done, it has about a 75% success rate, which I think is pretty great.